All right. I am super excited to be here today. My name is Jorge Ungo. I am the CCHI Language Access Advocate, and I'm thrilled to be joined here today by one of our CoreCHI performance certificants, a Kenya Rwanda interpreter, Amudu Salongo. Amudu is joining us from Buffalo, New York today. Welcome, Amudu.
Thank you so much, and I'm honored to be hosted by you today.
Wonderful. Well, we're so glad to have you here, and we're honored to be speaking with you today. It's really exciting to see interpreters really embracing this path of certification and seeing value in pursuing their core CHI performance certification, a certification that is truly groundbreaking in our profession. There is no other test like it, and it's allowing interpreters from all walks of life, interpreters of all languages, all backgrounds, the opportunity to get fully certified with a performance-based certification. So we'll talk a little bit more about that, but really, what I mostly want to hear about and talk about today, it's about you, Amudu. I want to learn a little bit more about you. So tell me a little bit about your background. Where are you from? What's your language? And how did you come to the US?
Thank you so much, Ms. Ungo. Uh, Allow me to call you that. And my name Amudu Salongo, and I am from the Democratic Republic of Congo. That's my citizenship, and that's where I was born. I was born quite a very long time ago when we had a president called Mobutu. Unfortunately, I did not live to see his rule. When I was born, it was already crumbling. But I lived through a very turmoil situation where we had different presidents coming in, Mobutu, of course, being overthrown, Kabila coming in, being assassinated, his son taking over, but of course, who left peacefully. However, during all that process, a lot of things happened, and among those, there was the reason why I had to flee from the DRC and left there was in December 2012. I won't go there. It will be so much personal. So I left and went to Uganda. That's an African country, which is the neighboring country in the east. Um, but before leaving the Democratic Republic of Congo, I had started, of course, I did my primary school, which was so much interrupted by wars and what. So had some years of interruptions where I could not study, and that took me to complete very late. But I did what we call general pedagogy, which is education sciences. I completed my high school with good marks, of course, above the limit, 11 points above the passing score. Then joined a high institution of learning where I was going to do lab technology. Of course, I started and did my first year, second year. When I was in my third year, that's why the interruption came in. I had to flee in December, so I had not completed. Arriving in Uganda, I found myself with a lot of wealth of languages, which I had acquired earlier when I was in Congo. I already knew French because it's a language of instruction, and I knew Swahili because that was my mother tongue. But here I'll have to clarify that Swahili that I had, which is my mother tongue, is Congolese Swahili. That's a different version. But because I had love for languages, I had also tried to go further to understand also Tanzanian version, which is a standard version. So I'm so competent into it. I interpret it, I translate it. And also, when I was in Uganda, I tried now to also get deeper into the Kenyan version because I was with Kenyans and understood there was a lot of ramifications. So I had also to get into it, but of course, not I'll say not the slang of Kenya, but which is considered to be, I'll say formal, but with the Kenyan version. But also when I was still in Congo, I learned Kinyarwanda. Kinyarwanda is a language of our neighbors there, and with family ramifications, we have so much relations to Rwanda and also the way we live. I got so much interest into it. So all those languages, also Lingala added to it, but which was not that good. I fled to Uganda and I found myself with that wealth, but it wasn't that useful at the start. I had to learn how to survive there. As a new person, of course, I had to go into into entry level. So I started doing assisting during constructions, carrying, of course, cement, tiles, and what. But of course, I had something that set me apart was that I was able to speak English as I'd learned in Congo. Unfortunately, my English from Congo wasn't that useful because the Congolese version is more of American than the in Kenya. Oh, sorry, I'm sorry. In Uganda, they use more of British, but also affected by their local languages. Now you find you're from Congo, you're saying 30, and they're saying sate. So you walk through the pharmacy, you're describing what you're suffering from, and the attendants can't understand you, but whatever they're speaking, you're understanding it. So it said another problem. I had actually to enroll to the English class. It was called Refugee Law Project. That was an English class under the Refugee Law Project, which was a project under the School of Law of Makerere University. I got there and started learning, but of course I was learning, but working as a language interpreter, working with the USCIS and all the migration services. I was working with them because coming from America, we could communicate easily, but when I don't communicate with Ugandans in the same language. So that's how complicated it was. I had to learn here and graduated, but then I had understood the language here. So in my struggle, so I had to learn Luganda because Luganda was the only language that could allow me now to collaborate with law people because I was a law person. I had to sell clothes, to attend to people in transactions because I started working as a mobile money agent later on, transferring money, depositing money on their accounts. And it's not banks are not too much into it because people are low income earners, so they keep very little money on their accounts. That I'll say like $3, $1 per day. So you find the very low transactions that they have just to use them on their mobile devices. Now, the basics for you to communicate with them, you must know Luganda to avoid mistakes because of misunderstanding. Then you must speak English that they understand so that you can communicate with them. That's how I came to learn Luganda. Of course, I focused on Luganda and concentrated so much to the fact that I was able to communicate basically after 4 months. And after 8 months, I was interpreting Luganda in a religious setting, not formal setting. So I came to interpret Luganda in formal setting. That was also with the embassy, the Swedish embassy. That was I had been there for 4 years at that time. So I have also a good proficiency working level with Luganda too, which I had not talked about. So that's how I got into Uganda, navigated. But interpretation happened. How did I start with interpretation? I don't know if we are there yet, but I was talking about myself and how I got to Uganda. Do you want me to continue?
Yeah, go for it. Go for it. This is fascinating.
Okay, thank you. So how I got into interpretation is that after arriving in Uganda, of course, I found there my mother and my siblings. They had come before me. Um, I noticed that when I was going to the offices, people had problems even filling their forms. Now I knew languages, so I had people who spoke English, who spoke Lingala, who spoke French, Swahili, Kinyarwanda, and its versions because they're those ones who are from Mulenge. They speak Kinyamulenge, which is a dialect of Kinyarwanda but it's different. Then the Kinyabwiste, those who are from Ruchuru, different kind. So I would help them fill in forms, guiding them where to go, how do you go to the office of the prime minister and such things, because it also saves them from exploitation. When you don't know the language, anyone can take you for a prey. So that's what I started doing. Every morning I could go to the police station because there was a police station where everyone must register in Kampala, the capital city of Uganda. So I'll go there every 6 a.m. I volunteer until 8:30 a.m. I leave to go to now start working where I was working. I was earning my income from. And then I noticed that the US also was recruiting. So they at that time I joined when they were looking for Kinyarwanda, Kinyabusha, Kinyamulenge speaking people. And then some people went there, they were rejected because the language they were speaking is not what they were looking for. Now, this language was not my first language was lucrative. So I went and applied and passed. Surprisingly, I actually failed in Swahili because they did test in the languages I mentioned. For Swahili, I failed because they tested me in standard Swahili.
Right.
So I failed. I had to qualify again 1 year later. When I was working, they failed to get an interpreter. I came and they asked me, "You don't qualify." I explained to them why, and I told them I need another test. We did, and they said they were surprised. I told them actually we have versions. So you may judge somebody not to know, but they know. It's like somebody from France. They may say they know French, but when someone comes from West Africa, they won't communicate. I have that ability because of that familiarity, but not everyone can be able to communicate with them. So that's how I started now joining the journey of I got that training. It was a 2-day training with RSC Africa, which is the Resettlement Support Center under the Church World Service. So basically, we're being trained or being prepared to be able to facilitate communication when the U.S. Immigration Service is coming to take people or refugees for resettlement purposes. That was in I got that training in December 2013 and started working in January 2014.
Mm.
So that's when I joined in interpretation. Then later, I started working into churches and other ceremonies, functions like weddings, where they're multicultural. The MC will need somebody who will be able to communicate with different people. When people are having speeches, now you see, with refugee world, you become one nationality. So they are nationals, and another nationality is called refugee. It's not like the United States, you outgrow the status and become a citizen. These other countries, no matter how long you have been there, you remain a refugee. So you create your own community called refugee. And now when you have something like a wedding, it's now all those refugees will be there, but they remain with their languages. So if they are to give testimonies or speeches, they'll speak in two languages they're comfortable. So I'll be there. That's when I was spotted actually by somebody who was a supervisor of a company. She noticed that I spoke different languages, and she was like, "No." And herself, she was there to give a speech. I interpreted for her, so she said, "No, I want this guy." That's how it went. Also, they were advertising. They told me to apply. Applied, passed very colorfully. Started working with them, and that agency was an implementing partner for UNHCR at that time. I worked only for 5 months. They transferred me to IOM. So in UNHCR now, you stand. I was doing everything. I will do codes, I'll do medical, I'll do migrational, I'll do community, I'll do counseling. So it was all forms I was into them. And also some trainings could come progressively. But then when I was transferred to IOM, I went under the health department, which is called MHAC, Migration Health Department, Assessment Center. So that is health assessment part of it and also pre-departure part of it. So it is medical in nature. Well,
Mm.
I got more migrational terminologies, more medical terminologies. We got also trainings there in mental health. We got another training that was dispensed by some two doctors who came from the University of Minnesota under the uh, is it called Institute of Continuing Education? And from there, they came to Uganda, trained us for a whole week. Um, so I got those trainings and worked with them. Then later, also started working with the UNHCR investigative department. That was the IGO, Inspector General's office. Of course, supporting into investigation, analysis of evidences, transcribing them. Uh, but that one was not only in Africa, but sometimes even online, because we could do investigations sometimes in Belgium, in France. While I'm in Uganda, I'll just go to the office, put on gadgets, and then do it online. So that's
Mm,
how I got to grow always. Yeah, and uh, process was that not that smooth, but it was guaranteeing because growth was eminent. In this world, you don't grow unless you work. Experience has been the best process into learning. I learned very many terminologies in working, and I put so much focus into Kinyarwanda because I understood Kinyarwanda was actually a very lucrative language, and it
mm,
was special. Like there were not many people. Other languages would struggle, and but Kinyarwanda was a bit special. So I put so much emphasis on it because it wasn't my language. So I did not know it to the extent that I knew Swahili. I put so much emphasis. Even now, I'm still learning, but I know like I'm much better. And my best dictionary or consultant has always been a client. When a client speaks something and I don't understand it, I'll pardon myself to the person interviewing them or speaking to them and tell them this terminology I don't know it. I'll need your help. And they will explain what they mean. And sometimes because of ramification, some terminologies will be confusing. Maybe you have not understood where they come from. Because they will say Kinyarwanda, but when they speak, they bring in Kinyabusha or Kinyamulenge. And these terminologies sometimes they mean different things. So you have to clarify what do they mean. And it has
yeah.
helped me growing always. Yeah, that is my journey in Uganda. Then, as I said, I was a refugee. It reaches the time when I also got an opportunity to get resettled. I came here as a refugee, still pursuing uh, the same career. But when I arrived here, I started working, of course, like everyone else, an entry-level job. I worked as a custodian at a Nichols school for about 5 months. Yeah, but the 5 months when I started, I immediately started also working with International Institute of Buffalo and Journey's End as a part-time interpreter because they don't have two full-time. But then I got also those chances to understand now the American jargons and the system. And that's why I loved it. My work was in the afternoon, starting at 2:30, because even now that's the schedule I maintained. Starting 2:30, that's my full-time job. But in the morning, I use it to study and research, get familiar to the world. Even now, my full-time job is still 2:30 with language learn solutions. That's why I'm a Kenya Rwanda all call interpreter. It's always 2:30 and after. In the morning, I'm doing college. Right now, I'm doing college. So, and when I don't have college, I have those part-time jobs and also volunteering uh, to help my community survive. Yeah, because they always somebody needs help. I'm sorry. Just allow me to do this. Yes. Okay. It helps me always to keep moving when I get those uh opportunities to work. I learn. I worked with them as a court interpreter with until I failed to pass my tests. In June this year, I did my test. I got 52 for court interpreter in New York, and the passing mark is 53. So, so that's when I will get disqualified because according to the rules, you don't work with them if you have attempted and didn't pass. So I'm applying again, and January I will have to do the test, and I'm quite sure that I'll pass this time because now I'm studying. I'm doing my 2-year undergraduate degree as a paralegal and law student with uh, that is under SUNY, uh, Erie Community College. With what I've studied so far, I feel like it has helped me a bit to increase on my results. And I don't doubt that I can get 60 out of 75 this time.
That's
Yes.
awesome. Wow, what a story. I mean, there's so many things that I was reflecting on as you were speaking. One, I think here in the US, we definitely underestimate, I think, as a, just in generally speaking, the diversity of languages in African countries, and the need to um, be a bridge in that scenario where there are just so many different languages. And I mean, I lost count, Amudu, of how many languages you speak as you were telling me. It's incredible. What dedication on your part to pursue that. And to really be a part of that community, and have just such a servant's heart in wanting to obviously establish a career, but at the same time, it's so evident that you were doing this out of a desire to help the people around you, which is just so admirable and amazing. And then, to come to the US and to continue that path in a world where, you know, I imagine that for some newcomers to the US, this is just such a foreign society, a different life. Many of them don't have family members, may not have family members nearby to have a support. And so to continue that path for yourself, and to find the opportunities to create a career, to now be working for, one of the largest language services companies in the world, really. And still to find time to pursue your undergrad degree, to continue volunteering and serving your community. Yeah, it's pretty amazing. So thank you for sharing all of that with us, Amudu.
Thank you so much. Actually, from when you were speaking, I got in something like, I'll say maybe we have not gotten there, but when I was doing these tests of CCHI, CoreCHI fast, even before performance, because performance was a bit different from CoreCHI, but the CoreCHI is really cool as I saw it. I've been a trainer, an interpreting. I'm an interpreter trainer.
Okay.
Uh, I did it in Uganda when I was with Makerere University, and there are things that I trained that I've never been able to learn from anywhere. But based on experience, I had to develop other content from what I get online and my experience, and develop things that are factual. But when I was doing these tests, I found them so much realistic than when I'm doing training sometimes. I want to
Mm,
mention that some trainings we did when we did with college, with this college of continuing education in with these doctors from the University of Minnesota. It was very good because they were willing to adapt. They were teaching us some things, and we told them now here in Africa it may not apply. We bring them scenarios. Now, as doctors, you understand not everyone is a doctor. You have a high IQ, so they were feeling like, okay, tell us the example. We give them an example. We sit, we analyze, and say, no, this can't work. Then we need to re-prepare. So they went with an objective to re-prepare because they had to come to train again another time, but at that time in Kenya, and also train doctors and nurses because we told them, how so we go through as interpreters? We know what to do, but we're dealing with people who don't understand what we need to do and what we're doing. So they need to be trained. So they had to rework on it and shared with us more content later, which was adapted. So when I'm doing training, sometimes I actually don't understand. People don't know what we are going through. They said Americans, they don't understand it, the diversity, but Americans should, because at least we have English, American, and something else. I don't know. Okay, I'm sorry to say this, but which the black community more uses.
mhm.
It's another version. Uh, they should understand that it's different. Now, in our languages, it's worse because America, the whole of it, 52 states, count like the language they use is English. In Congo, we count more than 400 dialects. So the Swahili itself we speak in the eastern part of, because Swahili spoken is considered to be the national language of the eastern part. That means from the former Province Oriental to the former Katanga, with two Sud Kivus and Maniema included. That I'm talking about the former Congo, which had 11 provinces, not now that there are 26. But now All those from the north to the south, it's called Congolese Swahili, but each CEAP is different. Somebody will speak and I will know this one is from Katang. When the speaker know this one is from Bukavu. The speaker, this one is from Maniema. When the speaker know this one is from Kisangani. They're also different. And some terminologies are abusive in one area than the other. So you have to play very prudent not to fall into this. And then somewhere we have rules that we don't follow. Like when I'm being trained, I'm told like before saying this, you should, if you are going to use a non-standard version, you should always tell us about. Like for us in Kenya, Rwanda, if we were going to use that, then we will not progress, and the judge will be angry, or the doctor will be angry because a session of 5 minutes will take 20 minutes. The best
Right.
judgment should play here. It is standard to you in your dialect, but it's not standard for Kenya Rwanda as in book.
Yeah.
So if you tell me the rule is always repeat, I may not make any sense, and I'll be fired because everyone will complain about me. So I felt like, but when I was doing the test, I found like, wow. And when I responded like that, they were like, yeah, this is, and there were guidelines. Yeah, it was very important.
Well, and that kind of leads to my next question. So, so you took the test, you took the course CHI. When did you take your course CHI?
But for CHI, I took it. I may not remember very well, but it should be around May or April this year.
Oh, of this year. Okay, of this year. And so you took your course CHI. So what led you to choose to take the course CHI? Why did you want to try and get the certification?
Thank you so much. First of all, I will make a disclaimer that my interest is not into medical interpretation.
Mhm.
My interest is into court interpretation. However, there is no court without medical. You don't choose what you do in court. And I've been in court interpreting for uh, uh, mental ill persons. When we're talking about how do we call this in the United States? Is about hygiene, mental hygiene act. You'll be dealing with doctors. We're talking
Right.
about mothers, or let's say, okay, we call them mothers in general. But I'll say in the medical in the legal field, it's not, they will not call it mother. They'll call them homicide.
Hmm.
We will talk about a lot of medical terminologies. Talk about body parts. So in many evidences, we'll talk about medical when it is related to how somebody's health or death. So this medical part makes me a better court interpreter.
Yeah.
But what pushed me to get certification? To be clear is that I had been an interpreter for so long, for more than a decade, in different settings with different personalities. I have gotten the best compliments. When somebody will complain about something else, but they will never complain about quality. Never. Not even clients. So if they don't, but when I'm getting trained, there are things I'm not seeing going on as I've expected. What is right and what is wrong? So I said the certification is a better judge. I need to submit myself to this one and clear the doubts first out of my head. But also when I do a certification, it will help me to understand where do I perform well and where do I need improvement. The aim was not only to get the certification, but to understand where I need to improve.
Wow. That's
So,
that's huge. So important.
so I did the test, I passed, but it showed me because the way the result came, it was so detailed that it was showing even the score in this, in this, in this, in this. Then I understand, okay, so that means I need more emphasis on this. And here I need this. Here I stand well. I think I'm making good judgment. But in this one, the terminologies are not still enough. I think still need to grow. That's why even when I go, I will tell people like, can I take a picture of this I'm seeing on your wall? I think there are many words I need to learn about. Like I was working with in a mental health facility 2 days ago, and I found a chart. It was talking about feelings only, and this chart had more than 50 words, and these words kind of sound the same. If I threw them to you, you may give a definition on one. When I give you the other one, you feel like, no, the definition I gave you was for this.
Right.
And I felt like, wow, so I need to sit so much well and understand how should I define each word without causing any confusion in the
Yeah.
future. And that's the kind of motive that brought me to do that test. And also when I'm guiding somebody else, I will be able to guide them in the right way because it's something I've gone through. And I think everyone should be certified. If you really think you're ready, you should be certified. And if you think you're not ready, you should learn to be able to pass that certification. But don't assume you're ready if you still are scared of doing the test. Because
Mm.
praises can be much, but praises are from lay people. Praises are from lay people. In language, we say that, actually, it's not in our language. Uh, in Luganda, they say, atana tambula, atenda nyino kukumba. Whoever hasn't more travel always praises their mother to be a good cook, the best cook, because that's the only meal you have eaten. So you can't compare it with anyone else. So,
Right.
but if you have traveled in different homes, like mom cooks, but I think this salt is too much. There is a better meal here. So a lay person can say, yes, you're the best, but are you really the best? That's what they have seen, and they don't know. They don't understand even what's going on the other side. Sometimes we feel it like here when I'll get in a call when an interpreter has been dropped, and then they feel like, wait, this is a client, a limited language proficient person. Wait, what this interpreter is saying, I think it's not what I heard earlier. You mean this and this and this? Yes. Now, I think we need to go back to the beginning. I understand this event very well. Something was missed. And we go back and say, whoa, I had declined this, but I think it's what I want. And this one, I think it's not important for me. I don't want it. And you understand, like, okay. So they never contested because they never knew anything. But now they have a different person and they're finding it to be different. So they are cautioning what happened earlier. Because you see, like when you get to the session, only somebody takes you back a little bit, catch up where you had been. You get that? And
Yeah.
that now when an interpreter repeats that, when they're catching them up, because like for transparency purposes, as a rule of interpretation, I will always have to say it. You're telling me like, now you remember. Thank you, Amudu, for joining us. I'm sorry we had another interpreter. He has walked out because he has an emergency. But now that you have come, I want just to tell you what has been happening, what we're discussing about. Then we can continue from there. Now, this patient, this and this and this and this and this and this and this, like for 3 minutes. And then I'll say, okay, thank you. Okay, my name is so and so. I'm sorry that the other one got an emergency, but I'm here to support you. Doctor was telling me how you had discussed about this and this and this and this and this and this, and they want us to continue from there. So, like, wait, is that what was said? So you'll find like there is always a comparison. So I will say everyone who thinks they're ready to do this exam, the core CHI exam, or they feel they can pass it, then let them sit for it and pass it. Then see where they need to improve.
Yep.
Because if you feel like you are at the top, you can't sit for the exam, then you are far from growing because interpretation is about continuing education. And you won't know where you need to continue unless you are evaluated.
Yeah.
That's the
Absolutely.
opportunity. Yeah. And that's the only
Yeah.
opportunity to be evaluated. Yeah.
That's awesome. I love it. It's so important, and it's so important, for like you said, it's not always about the accolade that you'll get, right? It's not always about the end result. That's very important, but to also give you a point of reflection on your on where you are today in your professional journey. And the goal is that people will pass the exam, and that that the exam is a true measure of what an entry level interpreter where they need to be in order to do the job safely. Um, but like you said, it gives you a window into your own skill set, and so important. Now, after taking the core CHI, then you took a bold step and sat for the E to E exam, passed it, and you earned your core CHI performance exam. So first of all, congratulations. This is a very unprecedented exam, an exam that many people, just by reading the description, have a hard time understanding what the exam is all about. Um, but it is a performance exam that can be administered to an interpreter of any language because the entire exam is in English. Yet it still measures the core skills of a interpreter uh, through a performance exam. So for Spanish interpreters, Mandarin interpreters, Arabic interpreters, they take a bilingual exam, right, where they actually interpret from Spanish to English and English back to Spanish. But with the E to E exam, it's a little bit different because everything's in English. Yet you were a brave soul and you took the exam, you passed the exam, and so now by passing the E exam, you have your core CHI performance certification, the highest level certification that a interpreter can have. And what's even more incredible about this is that in order to take that certification, you had to prove your language proficiency in Kinyarwanda. So not only are you a Core CHI performance certified interpreter, but on your certificate, it actually says proficiency in Kinyarwanda. I don't know that there's many other folks out there like yourself that have that highest level of certification. What does that How does that make you feel? What does that mean to you to have something so unique?
Wow. Thank you so much for congratulating me. I said, really, it's not that easy to decide to do that. But when I did my post CHI immediately and saw that I passed, I went to look at what is next and what is higher. And I was getting some emails from people. They'll tell me, oh, we do this training, this and this and this. Then I'll ask them, what's the advantage? They'll tell me, it's okay. I have post CHI. Do I need to come? Oh, no, you've hit the roof. We prepare you for that. So you don't need this anymore. Actually, we need to put you maybe on our list if there is somebody who's looking for somebody of your qualities. And so like, now, what do I do? Other languages, I found like they're above and we can't go there. Said like, now, what do I do here? I don't want to go for French because why I don't want French? Because I got in America and found like French is too much also. I don't want where everyone is. I want scarcity. I want something rare. That's why even I don't my French I don't write it anywhere like so much. It's only when it is required. But I don't want to put it anywhere because everyone is speaking French and no, I don't go for that. So I noticed there was nothing. And later I saw the advert. It's now there, E to E, and it allows us to be at the same level with those others that said, okay, now this is good. Fortunately, also an advert was made of a scholarship. Said, why don't I apply? Put in my application. I was accepted. Now, first of all, I would say in the whole process, when I was having all this frustration, I want to go higher. I had somebody who was helping me through. He's called Robert Thoren. That is the director of language interpretation at the International Institute of Buffalo. Thanks to him, he always helped me to know the steps and advised me and sometimes sent me links. This you can get it here. Because sometimes being new in the country, you don't know even resources where to get them. But he has been very, very resourceful, even in preparations. He could tell me, if you read this, I think you can get more. Yeah, though you have some tests you can do, can prepare you. Of course, they will not be the same questions, but they give you an idea. Try this. He has been so sorry for successful. He has not only been my supervisor the other side, he has been like my friend. Whenever they say, because CCHI is not that company that everyone will think, it is so, so rigorous. They have a lot of things they ask for, but also they're lenient and they understand the explanation and they are willing to take steps. Like they doubt what you give them, they take steps to investigate and validate it later. Don't just reject and just shut you down. They respond to inquiries, which is very important. So when I did these tests, first of all, maybe before going further, I would say even the core CHI is something very important. I, of course, don't carry my lineage everywhere, but it is something important because there is nothing frustrating like meeting a disgruntled client. Somebody has looked for an interpreter and they have messed up, they have caused him problem. He's always trying to examine you before working with you because they are not sure that you're a good interpreter. So having these certificates and you have that lineage and all badge or core CHI, they'll sit and they'll know, okay, I don't need to evaluate them. They already been evaluated. So it's
Right.
something very important because whenever they're evaluating you in front of a client, you feel frustrated, you feel embarrassed. You understand what I mean?
Yeah. Yep.
So this prepares you to go through that.
Mhm.
So when they get interpreters through agencies that have thorough selection, like language line solutions, they feel okay. Now when they come to these other agencies, feel like, is he good? Or like, But when you go with your lineage with the CCHI or your badge, of course it spares you. They feel like, oh, I don't need to assess him anymore. He has been assessed. So he
Right.
goes through. So it's very important for that level. Now, why did I go for CHIP? English to English. I will be honest. English to English is something difficult. And everyone fearing, I'll find a reason for them to fear. Do you know why? If you allow me, I will take you through a process. Interpreters are not just machines, but they are processors. First, they hear a message when you speak it. When they hear it, they must analyze it so that they could understand it. After analyzing it, they associate it to events so they can grab it in their brain, but then they transform it in a different language, then they speak it.
Mhm.
These processes happen in seconds, if not milliseconds. It's a very long process. Now, as an interpreter who worked for 10 years, this process has been streamlined and harder to change. And the most difficult part is the transforming part, or the translating part. It makes my thinking process be in a different language. Now, when you ask me now to speak in the same language I heard, you're breaking my thinking channel. I don't know if you have thought about this, but I think I put it in my comments when I did my test because at the end they give you an option where to put a comment. And I tapped that, I think, for very long, I think 5 minutes. And it makes it hard. You have thoughts, now you're telling me to unthink. So it makes it hard to go back to English from English than now to speak in the language I was prepared to speak into. Now,
Right.
when you speak in English, to go to Swahili, very easy. Go to, to Kinyarwanda, very easy. To Kirundi, very easy. To Lingala, very easy. To Kinyamulenge, very easy. To Rufumbira, very easy. To any language, very easy because I've already gone. Look for, okay, this one doesn't have this term, so it's this it's this sentence that means this word. I've already prepared that. Very easy. So if I can be tested E to E and get, let's say, 75%, I'm sure if it was to my target language, I will get 95%.
Mm.
And that leads me to say there is still need to work on that. I know there are so many languages, it may be difficult to get all of them,
Sure.
but when I was doing my test, um, before being hired, I was submitted to tests. I don't know how this AI was developed, but I was challenged by AI, and it was speaking very good in Rwanda, and that conversation translation, and that translation, I liked it because it was giving feedback. Like when I say something and it's not that very accurate, when it is replying, when it is asking the following question, they would repeat what I said earlier and correct that word that I did not put exact. They give me the more exact one. So it was actually a process also of learning when I was being doing the sound test. So I would say if this one is done, it's also done, it will make it much easier. However, it's not reason enough for somebody not to do that test because it tests a lot of things. Tests a lot of things. So you may be failing on one part, but at least you're understanding the others. Like saying, give a summary, give the general idea, that has nothing to do with with the saying back. But that one or the problem, that one affects more of memory.
Mm.
Yeah, bringing it back. And even the accuracy, like, things may go out because it's the same sentence you want, the same way, and I have it in the other language. Bringing it back, sometimes you get synonyms. And when you're giving a synonym and you know that it's not the word which was given, it makes actually what I would say is when you're doing it again back to English, you must do the same process again in reverse. It's to this language, then back. So it becomes a double. That's where the problem is. But it's very important, and I wanted it badly because it put me at the top.
Amazing.
I don't want to be in the middle. I don't want to be where I want to be at the top. And the last time I checked, I was the only course CHI-P certified interpreter in the world in Kenya, Rwanda, in the whole world. I was the only one. So if Guinness record was there to say who was the first person, then it would be me. And I hope CCHI will note it somewhere that I was the groundbreaker. Because when I got CoreCHI, I had found I was the third person to get it in the United States, and I was only one in New York. And I had checked, no one had any CCHI certification in Buffalo. At that time, I was the only one in Buffalo. Now in Western New York, I am the only one with CoreCHI in whatever language exists. I'm the only one. So it sets me apart, and I feel like, wow, I need this. If other people will find me there, I love it, and they will consult me. I have friends who want to follow the same path. Now they can ask me, and I will have what to tell them. Yeah. Mm.
It's super inspiring, and I think that so many other people watching this are going to be so inspired by your journey, by your perseverance, by your desire to reach the top. And it's just such an honor to meet you, to talk to you, to have you amongst our certified interpreters. You know, it is that passion. It is the same passion that you speak with that we embody at CCHI, you know, in supporting our interpreters, in improving our certification programs, in wanting to raise the bar in quality for patients, for providers, for the whole industry. And to have you amongst our certified interpreters, Amudu, is just, it's an honor, it's a privilege, and again super proud of you and excited to see where your career continues to go. So we're going to wrap it up here, but I want to thank you again for joining us today. And yeah, I'm just so pleased to have this opportunity to speak with you. And I know we're connected on LinkedIn, so I'll be keeping an eye on you and on your career, and just wish you all the best.
Thank you so much. Thank you personally for contacting me and conducting this interview. I thank CCHI for doing this step. It's a very important one, and for sure, I'm one of the people who advocate for access to information, and only through access to information, I will say, with this certification, you are carrying a lot of burden in the way. By providing with these certifications, you force people to go through certain criteria, to go through certain trainings. It forces people to learn and accept to serve where they are informed and they are able to. Then this certification, when it goes broader, I think maybe it will be the obligation for anyone providing these services at a certain level, because of course my mistake can kill somebody. My mistake can get somebody in jail or in prison when they are really innocent. So that is something that I appreciate you for. And also, doctors should not be worried about the interpreter because you have taken care of that. Now, the doctor will come and will study only to do their job. And when they're given an interpreter, they're sure this person is my partner. Where I am short, he got my back. But if he's not, then he has a lot of worries. He knows he's a good surgeon, but he's not sure that his work will serve this person because he's not sure with the partner. And thank you so much for doing that.
Thank you, Amudu. Well, we wish you the best, and we will. Yeah, like I said, we'll be watching your career as you continue to just shoot for the top. So thank you for being here.
Thank you so much. Have a good one.
You too.
Bye.